Hello, my name is Debraj Mukherjee, and I'm a neurosurgery attending at Johns Hopkins with a clinical focus on treating patients with brain and skull-based tumors. Today, I'd like to tell you about a recent clinical study produced by my research group in the journal Clinical Neurology and Neurosurgery. Our study focused on the treatment of patients with pleomorphic xanthoastrocytomas, or PXAs. PXAs are low-grade tumors of the brain, and historical series have shown that gross total resection of these tumors improves overall survival. What has been less clear is the role of chemotherapy and radiation after surgery in these patients. To investigate, we looked into the National Cancer Database, which is one of the largest brain tumor datasets in the world. Between 2004 and 2016, we identified 550 patients with PXAs. The average age in this cohort was approximately 35 years old, and the average overall survival was greater than 10 years. We wanted to dig into some of the different factors associated with survival, and we found that gross total resection improves survival, as did chemotherapy. Interestingly, older patients, those older than 65 years old, had greater than 2 times the risk of death relative to younger counterparts. Now, investigating radiation after surgery has been a topic of interest for many years. We found that those patients who had radiation after surgery had overall survival of approximately 1.5 years. In contrast, patients that underwent surgery but did not have radiation afterwards had an overall survival of greater than 10 years. Thus, patients who underwent radiation immediately after surgery had greater than 4 times the odds of death relative to those patients who did not have radiation routinely after surgery. Now, there are limitations to any large database study. For instance, sicker patients may have received radiation rather than the radiation itself hastening death. Nevertheless, I think our findings show that we should be cautious about routinely using upfront radiation in patients with PXAs. Future studies are planned to provide additional insights on this important clinical topic.